our first panel session, and the panel session is on tackling stigma and discrimination. And I'm reminded of Iqbal's words where he says, "Akal ko aastan se dur nahi, iski takdeer mein huzur nahi. Dile bina bhi kar khuda se talab, आंख का नूर दिल का नूर नहीं। एक जुनू है कि बाशऊर है, एक जुनू है कि बाशऊर नहीं." And I think one of the issues of stigmatization, of discrimination, is our awareness, our perception, and our attitudes. We have a very talented panel for this session. I'd like to invite Mr. Nisar Ahmed, the Deputy Chief, Social Welfare Section, Ministry of Planning, to please come and take the seat here in front. Khalid Naeem Saab, who is a legend himself, former DG Special Education, CEO, CEDA, country rep for ICVI, and a host of other things, consultant for JICA, and one of the luminaries for the disability movement in Pakistan. Chaudhry Mohammad Bilal, Manager Program, Site Savers International. My very pleasant duty to invite Ms. Abia Akram, who's the CEO of the National Forum of Women with Disabilities. Abia, please join us. Okay. And Ms. Kezia Noshin from the St. Joseph's Hospice in Rawalpindi. Is Kezia here? Kezia Noshin? Okay, please join us. Kezia Noshin from St. Joseph's Hospice. Please join us here at the front table. For those of you who may not be aware, St. Joseph's Hospice is probably one of its kind institution in Pakistan. Please do look them up on the internet, Google them, and you'll see a wonderful work that they're doing. And last but not least, my good friend, Ms. Farah Naz, who's the country director for CBM. Farah. Abia, oh, there you are. We can't start the panel session without you, Abia, so please join us anywhere. Okay. Ladies and gentlemen, the format that we're going to use is I have some questions that I shall ask of the panelists, and they will then give their responses, and then we'll have some time to take questions from the audience directed to the panelists, and he or she, whoever is most appropriate, will be requested to answer. At the end, I will just do a little summing up of the session, some of the key issues emerging, and then request the chair of the session to give his concluding remarks at the end. So, to start off, Abia, nothing about us without us? All right. Stigma and discrimination in practice towards people with disabilities. What does this mean in practice when people say stigma, discrimination, people with disabilities suffer from that? What does it really mean? You need this? All right. Now it starts.
Hello. Hello.
No, it's not working.
Thank you so much, sir. Thank you for having me in this panel and organizing this important discussion on the Disability Summit. And as you asked, like, how we see discrimination in the disability or stigma. Like, we have 10 to 15% of the total population are persons with disabilities, and 50% of them are women and girls with disabilities. And if we talk about the development sector or the humanitarian response,
the discrimination is double or sometimes triple or fourth time, because the women, they don't have the important, like economically empowered. Secondly, they are living in the developing countries. Developing countries where we have the concept or the extreme, like persons with disabilities are very close to Allah. So we have to respect them. We have to protect them or take care of them.
Or on the second hand, we thought like persons with disabilities are the punishment. The parents or the family members have done something wrong, so that's why they have the person with disabilities in the families. So this is the stigma or the practically we are facing in every day in our lives. The attitudinal barrier, number one, because person with disabilities, they are confined in their homes. Nobody want to talk to them. Nobody want to listen to them or include them in the decision making or to talk with them. And secondly, the physical or the accessibility barriers. Because if you have the attitudinal acceptance, like maybe some families are respecting them and want them to be included, but the infrastructure is not accessible. Where they will go, like the wheelchairs they don't have, even for the washroom they can't go by their own. Their mother, their father or the siblings have to carry them up and bring them to the washroom. So where is the dignity, where is the respect of those persons with disabilities? So this is the biggest stigma or the discrimination we are facing. And thirdly, the communication barrier. Because if you have a deaf or blind, like nobody can communicate with them. We have like lots of harassment and violation against women and girls with disability. But we can't report it to the police because nobody understands our language. Nobody knows like how to address these issues for like concerning the women and girls with disabilities. The social and plus the sexual health and reproductive rights and all these areas which is completely untapped. Because nobody have understanding to discuss or to share or what it's important to discuss. So this is the third like barrier they are facing. And the fourth is the legislation and the communication, because since morning we are hearing we have a lot of documents, policies, legislation, but we don't have the actually implementation plan. Yesterday we were in the Election Commission of Pakistan and we were having a very good news like a person with disabilities can cast a vote through the ballot paper. But when we were stuck because the process is so complicated and how we could detail, like share the details with all the local communities in the grassroots level, how we could bridge that gap of information, existing of the materials, the policies, the legislation, and how we are translating it to the people who are the real accountable. Like they are the ones who are going to address these issues, they are the ones who are going to work. So people's accountability, we don't have that kind of systems existing in our country. So when we talk about this global summit or the legislation, it's very important to listen the voices of the people who are on the ground, who are working with the disabled people organization, who are the key stakeholders. Because we are going to learn from their experiences and then we will bring those voices to the national level and then we will take the global steps, because this is what we actually need. The state have the responsibility to implement or work closely with the person with disabilities to make the sustainable plans. We don't need one-time interventions or two-time intervention and then it's finished. So this is the discrimination.
Okay, Abia, a challenge question. You've raised some very important issues. Attitudinal barriers, physical, communication, legislation. Persons with disability, do they contribute to stigmatization and discrimination? Are they themselves part of the cause?
In fact, we have three kind of persons with disabilities that exist all over the world. Number one, who feel disability is an inability. They just take disability as a barrier or something, very personal. And they thought like, oh, we are disabled, we can't do anything. We have to depend on the families or the other people of the society. So this is the one category which we see very common. That's why we say like special people or handicapped or some very stigmatized kind of persons. And the second category is those who feel like disability is a challenge. We can contribute anything. If my siblings are going on the 4th floor on the stairs, I can also prove that. Every day they are struggling. And they are trying to raise their voices or go there with the support of the family members. And they said, no, it's fine, I will manage by my own. And the third category are those who are change makers, who accept their disabilities, and they said like, yes, we are disabled, but we have some rights. We can't go on the stairs because we have our dignified life and we are wheelchair users, so we need a ramp, we need a lift. And those kind of persons who are creating the change in the society and running their own disabled people organizations, and we call them like persons, leaders with disabilities, who said like nothing about us without us, then they will give the clear message like how you see the disability as a development concern. It's not only the medical or the rehabilitation or the charity-based approach, but it's more on the inclusive development.
Okay. Kezia, we move on to you. St. Joseph Hospice tackles a variety of issues, not just disability, but, cancer, dreaded diseases, and so on. You see a lot of stigma. You see, you see a lot of discrimination and stigmatization in practice. What is that? What examples do you encounter, and how have you tried to address those issues?
St. Joseph Hospice Association is basically, it was created to treat and provide medical treatment or rehabilitation for the disabled people and who are terminally ill people. So we have seen a lot of discriminations, and it is really sad to say that most of the discrimination the patients with disability, they face from their own family members. We have seen parents leaving their disabled children and they don't even come for their follow-up. And likewise, the children, they just leave their parents because they are disabled or they are not able to take care of them. It's sad that these things are really happening in our country. This is true. This is real. So, yes, we have seen a lot of discrimination, and we need to really work up. We need to raise voice or awareness against these issues.
And that sort of ties in with the attitudinal barriers that she raised, and you actually see the front line effect.
Yes. And, there have been many times when we have actually, apart from providing treatment, we have provided consultation, especially to the, their attendants, that this is your responsibility. You need to take care of your parents. You need to take care of your children. They will be treated better at their homes, not here, We only treat or admit the patients who are, homeless, when there's no one to take care of them. So, yes.
Okay. Let's move on. Farah, civil society is very active in the area of disability, humanitarian response, and so on. Are there examples of how non-state actors have tried to address this issue of stigmatization and discrimination, particularly for people with disability?
A difficult aspect to talk about. However, there are small-scale examples where organizations have tried to work on tackling stigma and discrimination. Although, generally speaking, it's a very challenging task, because not just it's not only stigma and discrimination. There are practical issues that people face alongside tackling their own individual barriers as persons with disabilities, their families' own perceptions and thinking. Then you come to the community, and then as Abia had already mentioned, the infrastructure, the barriers in institutions, and all those things. So comprehensively addressing it is quite a major challenge. However, there are examples where organizations have tried to set up model communities which would have all these issues systematically addressed. For example, I can give you one example from CBM working in Nepal, and we are trying to replicate the similar examples in southern Punjab in Pakistan as well, and hopefully we'll be able to show some models of Pakistan as well in the near future. But for that, actually initially, an assessment with the help of persons with disabilities was conducted within the community, keeping in view the key barriers in terms of institutional, social, infrastructural, own perceptions, and whether or not persons themselves they feel capable of doing things or not. Unfortunately, almost in one union council, when they took these 10, 12 villages, about 80% of the persons with disabilities had absolutely no education. They had never had a chance to go to school, and this is age between 15 to 50 years, persons with disabilities in this age group. They had never had a chance to go to school, and and persons with severe disabilities, they were kind of bedridden in those communities. They had never seen outside of their compound because nobody would put that effort to take them outside, no assistive devices. And if those who had assistive devices, it was very difficult to maneuver those to various different places in the community because places were not accessible. The infrastructure was not accessible. The families thought, okay, we take them out, or we let them, people who were a little bit more stubborn and still wanted to go out, the families felt that, oh, this guy or this woman will injure herself, and then we will have to take care of them even more. The wounds and whatever else, we will also have to care about that. So, I mean, just to bring to our mind the picture of the level of these barriers at various stages, this all, plus then beliefs like what already has been said by Abia, that some people say they are alalok, some people say, and especially for the persons with mental health issues, some people would say they are crazy, so they could be violent, so you should be fearful of them. Similar kind of stigma as we have here in Pakistan also exists in Nepal. So after the assessment, then the various components of self-worth, self-image, how to build the confidence, how to give them independent living training, and if the assistive devices are to be provided, first the infrastructure also has to match that so that people can easily and freely move, and what could be those aspects where local solutions can be found in order to make every place accessible, and then helping them to form groups which will continue to support each other was another aspect of that, so that, even if some people, their confidence may be better, for some people it may not be that good. So continuing to engage them in groups so that they continue to support each other. Alongside that, then working on vocational skills and helping them to set up their small businesses or to work somewhere, find employment or do something, because people who are not literate, they are not allowed to enter any institution of vocational training, even though the criteria would be relaxed for them, but still the institutions would require them to at least have 8th grade or something, some level of education. So for some people who were still in younger age and could join the institutions, the crash course in terms of functional literacy and numeracy were started so that they can then linked with those institutions and transport can be provided to them. So a lot of practical steps, but at the same time, community meetings, awareness raising within the community, talking about rights of people, then providing practical solutions to the families also, providing them training, and if there were people with mental health issues, then how those conditions can be managed properly and people can become more productive in their social and economic life. All kinds of aspects needed to be looked at, and eventually now we can say that to some degree we have those, after 5 years of work in those specific communities, we can say that this is some exemplary work that has been done in those communities, and the model communities have been set up.
Okay, Farah, you raised some really important points. One is about disability assessment. Attitudinal barriers, I think that's coming right across, cross-cutting here.
Yeah.
Assessments and how humanitarian responses. And I can see the Chief of Plan is here. And I'd like to ask you, not just from a plan perspective, but from your experience in the disability, in the development sector, how disability responsive are the development programs, whether they're in education, whether they're in health, in economic empowerment, and what about humanitarian responses? To what extent are disability assessments made part and parcel of them? Because these are some of the issues and challenges we're facing. So we'd just like to hear your thoughts about that. Microphone, please. Microphone.
Can you hear me? It's something that I'll speak from over there. I'll use your mic.
Yeah, it's something that you have to give it a thought and plan ahead for it. Like in Plan International, that's one of the things that we have to do, that whenever you're designing a program, you look at gender, you look at inclusion, and when you're looking at inclusion, you look at all sorts of disabilities. Unfortunately, it is there in theory, but when you look at it in practice, there are gaps. Like when we look at designing a school, we will look at the accessibility, especially for children with physical disabilities. When you look at hearing impairment, or you look at children with visual impairment, unfortunately we are not doing much on that. Like when you're having a workshop on disability, you've got somebody who's translating in sign language, something which includes those children or those people who have hearing impairment. It's not being done universally, it's not being done in every program. So the basic thing is that even though it is there, having it regularly implemented and designed in each and every aspect and each and every program is still a long way to go.
Thank you for that. I mean, in humanitarian responses, disasters, response to disasters, Pakistan has borne the brunt of disasters in the last 10, 15 years. But sadly, we've not been able to really get disability component included in humanitarian response, in the assessment. I know the Aging and Disability Task Force worked on some guidelines, and Avia and others were very active with that. But how far that was actually disseminated and used, so that's really clearly one of the challenges appearing there. Khalid Naeem Saab, you've championed this cause, you've spearheaded this from the government side in all your active years, and also still doing that in your post-government life now. Are there any legislative or policy instruments or examples that protect persons with disability from stigmatization and discrimination? that we don't know about?
Bismillahirrahmanirrahim. Thank you very much, Dr. Saab, and very dear participants of this workshop. Apart from the question Dr. Saab asked from me, I will just try to bring your kind attention to some very important points. We are sitting here a group of about 50, 60 people. Is there any blind person? One. Okay. Then it means that I was thinking there was no blind person. So discrimination starts from this hall. Any organization working for mentally challenged people? The same person. So we must think about all these basic points in every meeting. Particularly now our recommendations are being sent to a global summit, and we have to send list of participants as well. Discrimination should be considered by a single person, by every organization, and at national level and at government level. Again, my question is, anybody from rural area except Farah Bhatt? She's working in Bari Imam, and if we call it a rural area, I know no participation from rural area. No, madam, no. You are also not from rural area. I know you for the last many, many years. No, not native village. I am just asking from now, from urban slums. So, these are very basic questions. We should include them without any discrimination. We talk about so many conventions, so many protocols, and all UNCRPD, SDGs, all in tune strategy. We read all those documents every day. But we must also consider something about example of one of verses of Holy Quran. आप सबको पता है कि नबी अकरम सल्लल्लाहु अलैहि वसल्लम के वो एक मजलिस थी और एक ब्लाइंड साहब, आप सबको याद है, हजरत इब्न अल मक्तूम, ही वाज ब्लाइंड साहबी, और आपने उनसे कुछ कहा कि अभी नहीं, आपका टाइम, अभी कुछ लोग बैठे हुए हैं. उस पर सूरह नाज़िल हुई, कुरान में सूरह नाज़िल हुई कि नहीं, आप इस डिसेबल आदमी को, इस ब्लाइंड पर्सन को इस तरह नहीं रवैया होना चाहिए. तो दीज आर सम वेरी वेरी इम्पोर्टेंट examples for us to consider about discrimination. About discrimination, Dr. Saab asked me about legislation. Unfortunately, we had only one discrimination for the last many, many years since inception of Pakistan, and that was Disabled Persons Employment and Rehabilitation Ordinance 1981. Now, very recently, Sindh government and Balochistan government, when we talk about Balochistan government, credit goes to Riaz Baloch. Where is he? He worked very hard. Is he? Please stand up. Big hand for him. Federal government, zero. Punjab, the biggest province, largest province, nothing. KPK, you know about all their revolutionary works, no legislation. Only Balochistan government took lead, and similarly Sindh government, they took lead in that sort of legislation. They prepared, and those two legislations have been approved very recently. Since 81 till 2017, there was only one legislation. That was also an ordinance, not a law or act. That was a ordinance. So this was fate of legislation. And now, although many efforts have been made, there was a group of people from the government, from the private sector, moved by the WHO. If Dr. Mariam is here, they started some campaign, and many of us sitting here, a group of 9-10 people, we have been going to National Assembly, meeting Speaker, meeting Senate people, meeting in the provinces, including Atif and Abia. A group of people, we used to knock the doors of these big forums, but there was no success. There is always time. I hope if government comes, and then this legislation again taken up, and that has been prepared, keeping in view UNCRPD and all our national policy and our national plan of action and provincial governments and the civil societies recommendations. Those are included in that Pakistan Disability Bill, which is a draft, and we hope that next assembly they approve it on priority. There are many things in employment, discrimination. 2% quota have been mentioned in the 1981 ordinance. Punjab government has made it 3%. What is fate of implementing this quota? Practically, I don't think even 0.2% is implemented. Similarly, in education, there are about 2 to 3 million children with disabilities who need to go to school, but only about 70,000 children are going to school, and those are about 600 schools in the public and private sectors. Now let us hope if inclusive education takes place. We started working on inclusive concept when Dr. Saab was head of Site Saver Pakistan. We started working on debates in 1996, and now we are pleased to know that the governments, civil societies, NGOs, CBOs, DPOs, they are now working on inclusive education, and this is the best solution. Now children with disabilities, particularly with mild and moderate disabilities, they can go to mainstream schools easily. And I would like to keep it on record that from the INGOs, again Site Saver took lead 20 years back, and still they are working with the help of DFID in Punjab. That is a big project, and we hope that with the implementation of that project, inclusive education will get some practical shape, and through this way, we as a nation will be able to send thousands of children to mainstream education. There are many other places like mobility, like accessibility, where our friends, our sisters, our brothers, they feel discrimination. For example, in religious institutions, hardly you will see any mosque which is accessible. Is it not discrimination that even these brothers, sisters, they are not even go to the mosque? Not only in mosque, similarly in churches and in mandars, if you go to sin. Now there is, because of awareness and work of particularly by the private sector, there is a lot of work, and now when we see the new buildings of schools, particularly in Azad Kashmir, Ma'am Nasreen Aziz will bear me out, that most of the schools, now those are accessible, the new buildings. Similarly in Pakistan, the buildings, the government of Pakistan, DGSE, Dr. Ahmad is sitting here, they prepared a building code that is approved by the cabinet, and there are a lot of details have been mentioned in that building code, that all buildings which are built in future, they should be accessible, and that will again remove discrimination for entrants, for their smooth movement of particularly physically disabled with wheelchair or with crutches. They will be able to go to these public places easily. Thank you, Dr. Saab.
Thank you, Khalid Naim Saab, and thank you for reminding us. I think Abid is here, and Abid will recall there was an Islamabad declaration on accessibility, which resulted in production of national guidelines on accessibility by the government of Pakistan. So it's not that the government has not taken certain steps, but it's the implementation, it's the execution of those. I mean, the guidelines are there, and yet they are not being used in infrastructure projects. So I think there are certain gaps that exist. G.
We know each other
Ji.
since long. I think entire government machinery is not sensitized to the issues of missing persons. If you move on to, I have seen personally civil aviation not providing ample chairlifter. Even the airlines are not sensitized to the issue of accessibility of disabled persons. When your own government machinery is not sensitized, how do you expect that these issues which are on the paper would be implemented?
Very good point. I can't defend it. After retirement, I am going to all provinces, meeting with all heads of, deputy heads of line departments, just to sensitize them. Even all provinces and Gilgit-Baltistan, Azad Kashmir, we are going there now from our own organization. Dr. Saab, Dr. Ahmad, किधर आपने दफ्तर जाके नहीं बताना, okay? मेरे colleagues को जो मेरे पुराने थे, I tell you very truly, he will bear me out. Even you go to DGSE, who are the representative of biggest organization in the country, most of them, they don't know UNCRPT. What is it? If the people who are supposed to create awareness, who are supposed to sensitize the nation, the other people, if they don't know, तो मैं तो यही कहूँगा इन्ना लिल्लाहि व इन्ना इलैहि राजिऊन, क्या कहा जाए? कौमी सतह पर हमारा ये एटीट्यूड है, बट दिस इज नॉट द वे आउट. कुछ ना कुछ प्रैक्टिकली इस पे करना पड़ेगा, नहीं तो फिर कुदरत के अपने इंतजामात हैं, अपने इंतकामात हैं.
I think that I'll come back to you in a second. I think the point raised by our colleague there is about the awareness and how the government systems incorporate disability inclusion. And we know the government has taken certain steps, but there's still a lot that needs to be done. And that brings me to Nisar Ahmed Sir. To what extent do social welfare programs reach or benefit persons with disability? I mean, that's your portfolio. So you're looking at a variety of issues, trying to see that programs are equitable, reaching the marginalized, the unreached, the hard to reach. But in terms of persons with disability, how effective is that outreach or coverage?
Thank you. Social welfare, there are different types of interventions which have been taken, are being taken by the government at the federal level and provincial level, in which are included policy, planning, strategy, interventions, projects, programs, initiatives, and so on. At federal level, there was a social protection strategy 2007, which could not be implemented in its real spirits. And likewise, there was a national policy on persons with disabilities 2002 and National Plan of Action 2007 and Human Rights, National Action Plan on Human Rights approved by the Prime Minister of Pakistan. So at the federal level, there is a Vision 2025, a long-term development plan, 5-year plan, annual plan. At the plan level, by seeking information from the provinces, NGOs, so and so plan is developed, and development plan, short-term and long-term development fully cover all the welfare initiatives for the person with disabilities. But as far as the beneficiaries and outcome of these programs up to the doorstep of the person with disabilities is concerned, so many areas are lacking, and the poor side is the implementation side. There is good policy, there is good strategy, there are good projects at the federal level and provincial levels also, but implementation is poor. Implementation is a dilemma of all the society. People think that this should be happen, but really it doesn't happen. It doesn't happen. Sensitization is a big issue, because the persons who are protector of the issues of the person with disability, if they are not sensitization, then the benefits of the welfare interventions under social protection strategy, under the social safety nets, under the social protection programs cannot be reached to the real beneficiaries. In this regard, the development partners, either they are the international development partners, local, domestic, so and so, they should chalk out their sensitization programs, sensitization, disability sensitization trainings, workshops, and such type of events for the government functionaries, who should first be aware that how these programs can be implemented to provide for reaching to the real beneficiaries, target groups or focus groups, particularly persons with disabilities who are living in urban areas and also in rural and remote areas of the countries. Thank you.
Thank you, Ms. Sabina. I think some really good practical points emerging from here, and that is about the sensitization, the orientation of public officials, government functionaries at decision-making levels about the issues of disability and how they can be incorporated in development programs. And it leads me to question, for instance, the PC1 format, which is the basic template for development of a development program, and yet it has nothing on disability in it. I recall there was a time when environment assessment was included as a socioeconomic assessment, human development and so on, but nothing about disability. And one of the simple ways to actually mobilize and try and implement this is to incorporate a section on disability assessment or disability, whatever, as part of a social sector development pro forma, so that when development schemes are being developed, they, by default, they will have to do some assessment for disability and using the guidelines. So together with the sensitization and awareness, but also making sure that the instruments that the government uses are also disability inclusive. So I mean, thank you for your thoughts. We have a question here from Madam.
I'm Nikhat Sadiq, National Director General Election Commission of Pakistan, and the way it was narrated that yes, we have the policies, we have the laws, we have the legislation, but there's no follow-up and there's no implementation on it. I would, taking advantage of the forum, would like to inform that Election Commission has an inclusive act now, which offers postal ballot facility to persons with disability. But the tyranny again is that only yesterday we were sitting with the Abia and Atif and we were trying to find or strategize as to how to reach out to the community who's to be addressed to this, because persons with disability had absolutely no inkling about this section of the act. So we quickly came up with a solution, and we came up with a 2 minutes documentary, and we uploaded that also. But yes, you're right. The community that is to be addressed doesn't know that these facilities exist. We have a gender and disability electoral working group for that, where we have persons with disability as members, we have transgender as members of our group. We have. Can you tell me your introduction?
I'm a physiotherapist by profession, and I work in St. Joseph Hospice.
Okay. Firstly, I want to correct you. You are right. I'm not your senior, but I want to correct you in one thing. Actually, disabled are not patients. That was their lifestyle. So kindly don't call them patient. And secondly, I want to ask you, the hospital you are working, is there any specialist in disability?
Sorry? Is there
any one therapist who are specialized in disability? You can see that.
Like the person who is working?
Yeah, therapists who are working there.
Therapist, no. No.
First
of all, I like to answer your first question. Basically, in our hospice, it is must that every person who comes with disability and who is admitted here, we do not call them patients. We call them our residents.
Okay. And secondly, I want to answer you. जो आप कह रही थी कि patient और मतलब के जो होता है डिसेबल वाला, वो एक दफा आते हैं, फिर उनके पेरेंट्स को कन्विंस करना पड़ता है. आई एम एग्री विद यू कि अवेयरनेस की इशू है, लेकिन इधर थेरेपिस्ट का भी थोड़ा इशू है. आई एम आल्सो थेरेपिस्ट, सो आई वांट टू टेल यू. इशू ये है कि हम लोग उनको रोजाना के हिसाब से थेरेपी पे लगा देते हैं. ये इनका लाइफस्टाइल है, और थ्रू आउट लाइफ एक पेरेंट हर रोज हॉस्पिटल नहीं ला सकता, क्योंकि उन्होंने अपना भी काम करना है. तो इसके लिए ना चेंज थोड़ा थेरेपिस्ट के अंदर भी लानी पड़ेगी. आई नो देयर इज नो एमएस इन डिसेबल्ड इन पाकिस्तान. तो कुछ थेरेपिस्ट को चाहिए जो बाहर जाके डिसेबिलिटी के ऊपर एमएस करें या उसको पाकिस्तान में लाएं, ताकि मेडिकल भी थोड़ा इम्प्रूव हो. और सेकेंडली जो आप कह रही हैं कि नहीं लाते बार बार, इशू ये देखें, अगर अब्बू या अम्मी रोजाना लाना शुरू हो जाए अपने डिसेबल बच्चे को, तो आप मुझे ये बताएं वो अर्न किस टाइम करेंगे, उनके घर वाले, उसकी अम्मी घर कैसे चलाएगी? बहुत इश्यूज हैं इसमें। और इसके अंदर मैं जो सजेस्ट करूंगी, लाइक मैं कर रही हूँ माइलस्टोन इन लाहौर, आई एम ट्राइंग टू वर्क ऑन डिसेबिलिटी इन रिहैब। एक्चुअली इसका इजी वे ये है, हम अमेरिकन प्रोटोकॉल फॉलो करें। उसमें हफ्ते में 2 दफा रिक्वायर्ड होते हैं थेरेपिस्ट को बुलाने में डिसेबल लोगों को। डिसेबल पेशेंट तब बनता है जब उसको कोई फ्रोजन शोल्डर या कोई डिसीज हो तब, ठीक है? वैसे वो डिसेबल लाइफस्टाइल है, लाइक जस्ट लाइक शुगर, हाइपरटेंशन, ठीक है ना? तो इसके अंदर आप वर्क कर रही हैं डिसेबल से रिलेटेड हॉस्पिटल में, तो मैं आपको ये सजेस्ट करूंगी, मैं भी आजकल ढूंढ रही हूँ कि आप अपने किसी थेरेपिस्ट को एमएस के लिए डिसेबल पे जरूर करवाएं, ताकि वो पाकिस्तान में आके सर्व कर सके, ठीक है ना? और सेल्फ एक्सरसाइजेस टीच की जाए डिसेबल लोगों को, ताकि वो घर में करें, उनको हॉस्पिटल आने की जरूरत नहीं है, क्योंकि हॉस्पिटल वो आएगा जो मरीज है और ये मरीज नहीं है।
Okay, like you have a question. Yeah, you're welcome. You have made many questions, so I'll answer you one by one. I don't know what is your profession. Like you said, you're a therapist. Are you a physical therapist?
Yeah, I am a physical therapist.
Are you graduate or?
Yeah, I am graduate.
Okay.
Can we keep the discussion at strategic level, not
yes,
personal
that's
level?
the point. That's the point. So I think this is not the platform where we are discussing that what kind of treatment do we need to provide to the patients, and what is the like criteria we can say these are the patients or these are the persons. So the first point, as you said, that they are not patients, I think this is not the platform where we need to give discussion, because I work there. I work there as a doctor there, and I run the OPD and I see the indoor patients as well, right? So maybe by mistake I have said patient, but you cannot say that these people are not patients are actually, we perceive patients are the ones who need some kind of treatment, right? We call people patients when they visit a doctor, and a doctor needs to prescribe some medicines or treatment, physical therapy, whatever, like psychiatric consultation, whatsoever. So those are the patients. So we deal, and as you are a physical therapist, and you may be dealing with, if you are working, you may be dealing with disabled people very much in your outdoor patient department, right? So do we say that these are not patients, or only the person with frozen shoulder or pain in the knee, only those are the patients? No, like if they are sitting in the OPD, they are there to get a treatment from a doctor. So like it is not a discrimination to call them patient at that moment, right? Because we at that time we are calling everyone patients. They are there to take the treatment. Another thing which you said, that we need to make a plan. I think again I will say the same thing. This is not the platform where I need to clarify that what treatment I need to give them.
Okay. Excuse me. Sorry.
Yeah. Sorry. Just one point.
Okay.
Sorry.
Okay. Very
one
briefly.
point. Just one point. So we manage the protocol of patients. We call them thrice a week, not daily, and we consider all these economical and social factors of their families as well. So
okay, thanks a lot. I think the important point that's emerged from this discussion is whether our professional training programs have disability inclusion as part of their syllabus. And I think this is a major issue. Whether we have a master's in disability and so on, I mean, those are different things, but training for physical therapists or physiotherapists, training of doctors, training of other disability professionals and so on. I know CBM took a lead in this, where they try to include an inclusion module, inclusive eye health module, in training of vision professionals, optometrists and others. And I think that was a recognition that the professionals are not sensitized. And I think if we have that, so thank you for that point. I think that's an important point that we want to take forward. Let's move here.
Thank you very much. This is Farooq Nassi, and I'm working with Islamic Relief Pakistan as Protection and Inclusion Coordinator. So first of all, I would like to, one comment, and this is really, really very important, meeting, and we are really thankful to the organizers. And I would just, there is one information and one commitment, which I should strongly recommend we should present into our charter of demands. We all know the persons with disabilities are neglected and ignored during humanitarian and development programming at all levels. And we know there are gaps in implementation, and we know we are lacking in resources, both the financial and the technical. I would recommend one demand only. If we commit today that at least at organization level, individual level, government level, if we can contribute at least 1% more to work more for the person with disability, in terms of, making them the facilities accessible, and in terms of, the benefits, and in terms of creating awareness. So I think this could create a huge, change in our society at country level, making them the facilities and accessible. Information, I mean to say, we have benefits, and in terms of creating awareness. So I think this could be my counterpart in London, change in our society. She will be presenting this at country level, making them the facilities accessible. So, believe me, at remotes and the hilly areas and the rural areas, the problem is many, many more. We don't, even, sitting in Islamabad, we can't imagine. So, there is need to work at grassroots level. In terms of discrimination and stigma, it's very important. This is the key, which reflect from the attitudes, and then